This is Dr. Jeff Hsu. We're joined by Dr. Billy Caceres and Dr. Carl Streed. Dr. Billy Caceres is an assistant professor at the School of Nursing and the Program for the Study of LGBT Health at Columbia University. Dr. Carl Streed is an assistant professor at the Boston University School of Medicine and research lead for the Center for Transgender Medicine and Surgery at Boston Medical Center. How can health professionals be prepared to be more inclusive of LGBTQ cardiovascular health?
We want to look at this across the spectrum of health profession training. Honestly, LGBTQ health content has remained only a recommendation across the professions and disciplines. It's never been a requirement. It has not been well integrated across discussions of cardiovascular health in particular, but other health conditions as well. I can think during my training as a physician, whenever we talk about tobacco or alcohol, there's discussion of other groups that there's been research looking at disparities and prevalence of substance use, but LGBTQ individuals remain absent from that, even though the research is quite conclusive about the higher prevalence of these risk behaviors. When we talk about particular health outcomes in my experience, in terms of from a primary care perspective, talking about cancer prevention or cardiovascular disease prevention, again, the importance of stress and LGBTQ identities is never part of that. So this needs to be integrated into the health professions training as a requirement, not necessarily a recommendation. And then, of course, that needs to move forward across every level of training to make sure that we catch everybody up. From my perspective as a physician, people who've completed medical school need to have this training as part of their postgraduate education, and people who are now practicing this should be a requirement as part of their continuing medical education.
Yeah, I think it's an issue across professions. And I think certainly during my training as a baccalaureate nurse and then as a nurse practitioner in my graduate program, there really wasn't much content on LGBTQ health other than I think HIV might have been touched upon, and really not even within the context of LGBTQ health. But I think what Dr. Streed brings up is really important. I think that we need to move beyond sort of these recommendations and actually find ways to integrate it into the curricula. What's been talked a lot is that it can't just be one special lecture that you receive every semester on LGBTQ health, that it should be integrated when you're learning about tobacco cessation. You should talk about tobacco cessation considerations for LGBTQ people who also experience barriers to things like substance use treatment. That's really the important thing, is to think about how can we now use this rapidly expanding research base to actually integrate that into curricula, to ensure that the people that are being trained to go out into the workforce understand this.